and no one else will. Call AA Lock, Dock, and Security at 867-1965. That's 867-1965.
All right, 20 minutes after 11 o'clock. Thank you for tuning in. Just a beautiful day. The forecast for today, by the way, whatever it is, 83 degrees, the expected high, something like that. Partly cloudy skies every single day for the next 10 days. It's the same forecast. So just enjoy what you've got right now. Dr. Michael Rezak is on the phone. He is a neurologist. He's the medical director of the Movement Disorders Center at Northwestern Medicine Central DuPage Hospital and the medical director of the American Parkinson's Disease Association Midwest Information. He's talking to us about research on Parkinson's disease and a potential diagnostic tool to confirm Parkinson's disease and maybe some hopeful news about that disease. Dr. Michael Rezak, good morning, sir. How are you?
I'm good, and I thank you for having me on.
Oh, you're welcome. I kind of hinted that maybe there was hopeful news, and I didn't mean to do that if there wasn't any, but it seems like every time I turn around in the world of health, there's a new breakthrough or new news that indicates something positive.
That's correct, and in Parkinson's, that's the case as well. We just had a new medication approved by the FDA last week. So we have a really nice armamentarium of symptomatic medications that we use judiciously, which can really improve quality of life for decades in some patients. So it's all about judiciously.
Can I ask, as a person who does not, I don't think I know anybody with Parkinson's. I might have one friend. I think he hinted at it the other day, maybe the early stages of it. But I'm wondering if there were any debilitating physical things that happen. The only thing I can picture is the shaking. Is there anything internal that happens with Parkinson's?
Internal, no, but of course, Parkinson's is, these are the major symptoms: tremor, slowness, stiffness, and gait and balance problems. So falling in some patients is a big problem, and that can really, be dangerous. And so we're very careful with all of those things also. There are swallowing issues sometimes in more advanced patients, and thinking issues in some patients. So there's a lot. Parkinson's is not just the movement part. There are a lot of other what we call non-motor features that we have to think about, sleep disorders and things like that.
Okay. When we talk about other diseases, early diagnosis is always something that's supposed to be good. Does that apply to Parkinson's also?
Definitely it does. We have studies that have shown that early diagnosis and treatment improves quality of life, and recognition of these symptoms, which are not infrequently attributed to old age, which it's not normal, and so people just live with it and are having problems functioning in their activities of daily living. That can all be taken care of once the diagnosis is made.
Does physical therapy help on the extremities that are shaking?
Absolutely. Yeah, we have, the shaking, it can be difficult. It's interesting that only, maybe 50% of patients will have a tremor. You don't have to have a tremor in Parkinson's. It can be one of those we call slow, stiff kinds. So there's a whole variation in the presenting symptoms of Parkinson's disease. But physical therapy, there are very specific voice treatments or speech therapies and physical therapies for Parkinson's. They kind of fall under the heading of Lee Silverman, big and loud. So big is we really train patients to take exaggerated steps. Their movements are all exaggerated. And when they speak louder than what they think is normal. And that can get their volume up so people can understand them and they can communicate effectively.
So this is a therapy we actually were privy to. We went to one of the local skilled nursing facilities here in our community. And
Palm Garden.
Palm Garden, thank you. They gave us a demonstration of the big and loud. In fact, they even named the same man you just named, Lee
Silverman.
Silverman, yes.
Yeah, actually, it was a woman. So
I'm sorry.
She was the first person. No, just for informational sake, there was the first woman they ever used the voice treatment on, and they decided to name it after her. And it's all over the world now. It's extremely effective, but it's really specific for Parkinson patients. It's not going to work on other kinds of patients.
And the big part of Big and Loud, too, that's the exaggerated arm movements and things like that. How does that actually provide therapy? I probably could have asked this when we were over there, but we were videotaping is why we were there. So
I see. Sure. So what we're doing with the voice and the big, we're actually retraining the brain to have a new normal. So naturally, with Parkinson's, you're going to take little steps, short strides. Your base is going to be very narrow. That's just the natural course of what happens from the loss of dopamine in the brain. But we can actually change that if patients are conscious of what's going on and they can think through this and turn it into not just a habit, but a permanent way of functioning. And that's the idea, is that intensive training, so it becomes part of everyday life, and you can kind of push back on what the Parkinson's disease is sending your way. And it's really very effective if the patients practice. They have to practice it.
That is very positive. Now, would the therapy mean that the amount of medication could be reduced?
Well, sometimes. I wouldn't say in general, but it might be. If it depends. If we're giving the medicine specifically for a balance problem, and we've corrected that with the therapy, and it's so good, we can try to reduce the medicine, see what we can get away with. So yes, the goal is as little medicine as we need, but we also want to make sure patients are functional and can enjoy their lives.
Once a patient is diagnosed with Parkinson's, does it have a time limit like some cancers do?
The answer is no. We have a lot of, so one of the phrases we hear is, if you've seen one patient with Parkinson's, you've seen one patient with Parkinson's, because there's a lot of variation. Every patient is different. I think the key is what we do in our multidisciplinary program here is really micromanaging patients. We see them frequently. We have all the therapies under one roof. We have psychologists, because not uncommonly there can be mood problems. And excuse me one second.
Okay.
And we have the whole range of treatment, including the deep brain stimulation and other forms of treatment.
We live in a world today where everybody can be an amateur expert, because we go to Google, we look things up, and if you have a family member, or maybe you yourself have been diagnosed with Parkinson's, you might find yourself going online looking up information, and some of it might be good, some of it might not be good. And that's why I love speaking to experts like yourself, because if there's a good website, chances are you are the person to tell us what it is, as opposed to finding out that, somebody who has an herbal rub is gonna cure Parkinson's. Yeah. I'm just being silly there, but you never know. You could find anything on the internet, right?
You're absolutely right. I really kind of bristle when Dr. Google gets brought into my office with crazy stuff, So, the good websites are, the national organizations like American Parkinson's Disease Association or National Parkinson's Foundation. Our website, which is www.nm.org/Parkinson's. That's where you want to go. There's so much really misinformation out there that, and of course, people are desperate for a cure. So these so-called stem cell clinics are popping up everywhere, which are just bilking people out of lots of money, and there's no science. They're all over, and we call it stem cell tourism. It's been a subject in our journals, and really it's very disheartening, because people are desperate and they will gravitate to something like that, and it's a mistake.
And when you treat people with Parkinson's, do you also treat their caregivers? You give them emotional support?
Yeah, we have a caregiver support group here. We actually just put on a patient and caregiver conference here. Yeah, I think it's extremely important to treat the caregivers, or at least pay attention to them. The burnout rate is high, especially in the more advanced patients, because the care is so intense, and if there are some cognitive problems that really adds another layer of burden to the caregiver. So we pay close attention to them.
For the listeners, we are, as radio people, doing interviews all the time, we are an innocent accomplice in some cases regarding bad information. Because if we're talking to somebody and they give us bad information, well, all we can do is repeat it, or the listeners hear it, okay? And I'm not apologizing, it's just the nature of what we do as talk show hosts. But when we stumble upon somebody or come across somebody who I know is giving good information, I want you to write down the website. I know I got 10 seconds to do this. NM is for Northwestern University, right? Northwestern Medicine.
NM.org.
Okay, NM.org.
/Parkinson.
Okay.
Yeah, Parkinson.
Doctor, thank you for what you're doing and for helping us understand this. This is important information. I want to make sure our listeners have it. We will put this podcast up online, and we will put the website as a link right on it as well. Dr. Michael Rezak.
Thank you.
Thank you for what you're doing.
Thank you. That's very important.
Yes, sir. All right, let me take a break. We'll be right back.
And making those comments on his way to Moscow really speaks volumes.
Presidential advisor Kellyanne Conway on Fox and Friends. Moscow says Syria is willing to let experts examine its military base for chemical weapons. And from another hotspot, North Korea.
Today, the regime blasted that deployment of the USS Carl Vinson strategic carrier group to this region. State television official today saying it is reckless, it is catastrophic, it is outrageous, and noting that North Korea is ready for war.
Fox's Greg Palcott. Fox